Welcome back to the Optum Community Centers. My name is Colette Norton. Joining me today is Jennifer Agee, mental health professional. Jennifer, what are you going to talk to us today about?
Today we are going to cover 5 areas you need to know and understand about seasonal affective disorder. We are going to cover what is seasonal affective disorder, what are the signs and symptoms of seasonal affective disorder, causes, who's at increased risk for seasonal affective disorder, and the treatments.
Oh, I look forward to hearing more about these.
Thank you. Many people experience periods of time where they feel sad or not like their usual selves. When these mood changes begin and they end, when the seasons change, it's often referred to as seasonal affective disorder. People may start to notice a decrease of energy, or they just start feeling down when we have shorter days in the fall and winter, and notice that they begin to feel better in the spring, which comes with longer daylight hours. Most people describe the beginning of seasonal affective disorder, we'll call it SAD for this video, for the acronym, as a feeling of lack of energy or motivation. These mood changes can be more serious and can begin to affect how we handle our daily activities. So if you notice any significant mood changes and behaviors that tend to switch and change around the seasons, you may be suffering from seasonal affective disorder. So what are the signs and symptoms of SAD? SAD does not have its own separate diagnosis. Rather, it's a type of depression that follows a recurrent seasonal pattern. Symptoms typically last around 4 months. That's it, out of the year. Think of it as the shorter daylight months. Before I share the symptoms, I want you to remember that because SAD is a type of depression, these symptoms are also often seen with major depressive disorders. So if you find yourself identifying with a lot of these symptoms, it might be time to talk to your doctor or your mental health professional. Here we go. Here are the symptoms that you need to be aware of for seasonal affective disorder. Feeling depressed most of the day, nearly every day. Losing interest in activities you once enjoyed. Experiencing changes in appetite or weight, especially overeating and craving carbohydrates. Having problems with sleep, especially oversleeping, which is also called hypersomnia. Feeling sluggish or aggravated. Having low energy, feeling hopeless and worthless, having recurrent thoughts of death or suicide, having difficulty concentrating, low motivation to complete tasks, isolation, feeling like you want to hibernate. If you think that you may be suffering from SAD, please do talk to your healthcare professional or your mental health therapist about your concerns, because there is help. So who is at increased risk for developing SAD? Actually, there are some specific groups of people that need to pay special attention to this. SAD affects millions of Americans, and the research has shown that it is more common in women and those that live farther north and experience shorter daylight hours. There are also certain mental health diagnoses that come with an increased risk, and I want to go over those now. People with major depressive disorder, bipolar disorder, especially bipolar 2, ADHD, eating disorders, anxiety disorders, or panic disorders. So if you fall into one of these categories, please pay special attention to how you feel as the seasons change. Tune into what you're noticing with your body. Notice any mood shifts that come. Those might be signs and symptoms that you have a seasonal depression. What causes SAD? Scientists don't fully know what causes SAD, but the research does indicate strongly that serotonin, melatonin, and vitamin D are all key factors. Serotonin is extremely important in regulating mood, and it's essential for maintaining our body's natural rhythm of our sleep-wake cycle, our day-night cycles. The way vitamin D gets involved in the party is that low vitamin D promotes serotonin, I should say vitamin D, not low vitamin D. Vitamin D promotes serotonin. So if our vitamin D is not being absorbed properly or we don't have enough of it, that's going to affect our serotonin levels. Vitamin D absorption is absorbed in one of 3 ways: food, your skin, and actually your eyeballs. A lot of people don't know that, but your eyeballs are where we absorb a lot of vitamin D. So I just want you to think about that logically. If we are needing to absorb vitamin D in order to mitigate any seasonal effects, when it's summertime, springtime, we go to work and it's sunlight, it's Beautiful, right? We come home, it's sunny, we feel motivated to go for a walk or go outside because it's still light outside, maybe a little warm. In the winter, often we go to work as it's still dark, we're starting to come up, and we come home when it's almost dark. It really decreases the amount of time that we have to absorb that vitamin D. Now let's talk about how SAD is treated. There are treatments to help improve the symptoms of SAD, and the main treatments are light therapy, psychotherapy, antidepressant medications, vitamin D, and B12 injections, of course, all under your doctor's recommendation. Let's break down the treatments that I just mentioned. The first one is light therapy. I actually use this myself and I find it extremely helpful. Light therapy exposes people with SAD to a bright light every day to make up for the diminished natural sunlight. If you use this unit, I'll show you what this unit looks like, for about 30 to 45 minutes each day, placing it 16 to 18 inches away from yourself. You make sure you get one that is UV filtering and UV free, and it has at least 10,000 lux. You're good to go. This mimics morning sunlight. I'm gonna turn it on just so you see what it looks like. See, not so bad. I usually just set mine on the table while I'm having coffee. Psychotherapy or talk therapy is also very helpful. As a therapist myself, of course, I would promote that, but cognitive behavioral therapy actually has a lot of research behind it with regard to SAD. Research has shown that although light therapy has the fastest results, talk therapy continues to have positive lasting effects for years to come. If your symptoms are very severe, the doctor may consider medication. If medication's needed, your doctor's going to talk to you about an SSRI, which is an antidepressant medication, because of its benefits in helping serotonin. The vitamins D and B12 are also important. People with SAD have a vitamin D deficiency. Your doctor's probably going to recommend a vitamin D supplement and possibly B12 injections for increased energy. Please consult your doctor before you start any supplements. I hope this information has been helpful to you, and that if you feel that you may have seasonal affective disorder, you know and are a little better equipped now to reach out and ask for help. Thank you for tuning in to the Optum channel. We are here to help you live your best life.